let's get started. Good morning, good afternoon if you're in the Eastern time zone. Welcome to Ask Me Anything, Medical Alley Starts. We have a fantastic discussion today. I'm joined by a good friend of the Association of the Medical Technology Community here, in what will be a wonderful discussion. As we're going, and I'll say this a couple of times throughout, if you have questions, remember this is Ask Me Anything, throw them into the Q&A function. I'll be triaging those questions and I'll pull them into the dialogue. But before we get started, I want to say just a couple of remarks and welcome our sponsors. For those of you who don't know, Medical Alley Starts is Medical Alley's initiative to lower the cost of starting, scaling, and pivoting new ventures. If you're a startup out there and you're working to raise capital, find customers, key talent, or suppliers, please do reach out to me or to my colleague Philip, and we'll be glad to assist you. In doing this work, we're assisted by a handful of just fantastic partners and sponsors, two of whom join us today, and I'm going to ask them to just make brief remarks and introduce themselves. And I'll encourage all of you, when you're out looking for services, support the companies that support your community. That's how we keep this ecosystem growing. And I might start with, because it starts with the letter A, Keith Schoolcraft from a couple of gurus. Keith, if you wouldn't mind giving us a quick intro.
Hey, thanks, Frank. Keith Schoolcraft with a couple of gurus.com. We are a technology service provider here in the Twin Cities, supporting world-changing organizations, and you guys in the community are part of that world-changing community. And so we just have a passion to help see you succeed and grow. One of the key ways we do that is through technology plans. This year, we're sponsoring 4 plans for the community. That's so that you can have the right technology stack to go from that startup stage to the scaling stage, because those are different strategies from when you're scrapping it and getting started to when you're scaling it. So we love to do that with folks. We're doing several of them currently here for several companies in Twin Cities, including med device companies. One, I always leave a food for thought for the community. So think about what success is. And I would argue that success is a habit. Thanks.
I always like that you do that, Keith, because it is always very thoughtful and a good way to kick off discussions. And then, Paul, if you would, give us a quick introduction on you and on Clifton Larson Allen.
Thank you, Frank. My name is Pau Carlson, and I'm a manager with CLA in our life sciences industry group. And CLA, we're a national professional services firm, and our mission is to create opportunities for our clients. And we achieve this by providing industry specialized services in accounting, tax, outsourcing, financial advisory, and wealth advisory. And we have experience in healthcare, life sciences, and providing service across the entire continuum of care, from early stage startups, pre-revenue companies, all the way to $100 million, multiple $100 million SEC clients. And one of our services that can be very beneficial is our outsourcing or business operations services, where it allows companies access to experienced resources, anywhere from bookkeeping up to chief financial officer, at a fraction of the cost of full-time employees. And this is completely customizable and scalable to the needs of the individual company. And we're very excited about this sponsorship with Medical Alley Starts. And as part of this program, we're offering 25% discount on all of our services for the first year of our working relationship. And this is a way that we envision that Medical Alley Starts companies can preserve capital and mitigate financial risk to allow the entrepreneurs and the business owners more time to invest in adding value to their companies. So again, we're very excited about the sponsorship.
Paul, we are too, and we appreciate it. Folks, I think you'll understand when we say we want to lower the cost to start, scale, and pivot, we are very serious about directly lowering your costs. And unfortunately, our friends from JP Morgan couldn't join us. They are one of the newest sponsors of Medical Alley Starts. Many of you probably know Mike Dietl and his team, who have been absolutely fantastic to this ecosystem. They've joined in supporting Medical Alley, to make sure that startup companies like many of you have access to world-class banking services, even when you're a small company. So they're investing in the community, they're investing in the association with their dedicated healthcare and life science teams that work with medtech, biotech, digital health companies from pre-napkin all the way through to taking companies public. And so again, folks, I'll encourage you, support the companies that support your community. It makes all of us that much more successful. And with that, we're to start the fun discussion here. I'm so pleased to be joined by Mark today. And Mark, just to kick it right off, I'll ask you, for the audience who don't know you, could you just give us a quick introduction?
Yeah, sure thing, Frank. Thanks for the opportunity. And I also want to thank Medical Alley. What a great advocate you've been for our local community. And Frank, we've known each other for many years. So thank you for all you guys do to make our work easier here. I grew up in Minnesota. Wife and 3 kids live in Shoreview, and I went to local Bethel University of Minnesota, received a double E master's. Went into Medtronic back right out of school. Wasn't planning on medical. Actually interviewed at Medtronic out of a lottery interview system. I must have done really well because I wasn't nervous and just interviewed great. They offered me a job right out of school. And I came away from that interview just seeing the passion that people at Medtronic had for what their jobs were. And I was really impressed by it. That really, was a pivotal moment for me. Worked there for 15 years. As part of my work there, I was blessed to be able to work on the Inspire project, which is now a public company in the Twin Cities here, but worked on that through the early years of that project. Worked in several other great divisions in Medtronic. And then had the opportunity to do Inspire and do a couple other startups. And now I'm currently a CEO of a company called Cryosa, founded by the name of Don Gonzalez, and great little company. But yeah, just that's a quick overview of my career path and the great opportunity I've had in the Twin Cities here.
Oh, it's fantastic. And I think you're right. Sometimes if we're doing an interview where we're not trying, we probably end up doing it better than when we're trying our hardest. You mentioned working on the Inspire project when it was within Medtronic, which now a very successful, fast-growing, publicly traded company. What was it like working on a technology that was a project, and as I understand it, kind of got set aside for a while, and then eventually spun out of Medtronic into an independent company?
Yeah, the first 6 years of Inspire was set up under the vice chairman, Glenn Nelson, had set up a startup company incubator in Medtronic. It was a really fun time in my career. We had all the power of Medtronic to solve unmet medical needs and a small group, typical startup company formation. But it was really painful to see it put on the shelf for a number of years. And Tim Herbert came to me in 2006, 2007 and said, "What do you think about spinning this out? Would you come leave Medtronic?" I think it was definitely a transition moving it outside, but I think we had a lot of support, a lot of, even like IT, figuring out who's going to do IT when you're used to doing that in Medtronic as a service inside the company. But it really went a lot smoother than I expected. There's so many great, people in the community that allowed us to get things done. And we had a lot of support from Medtronic along the way. But it was really coming outside of Medtronic initially, building a quality system from scratch, building a team. It was a lot of fun. It was a lot of work, but I think, I'd encourage others to try it. It was not as hard as I thought it would be.
Yeah, well said. Taking the risk can be well worth it.
Yeah.
Well, fast forward a bit. You're now at Cryosa. You're now running Cryosa. Can you tell us a bit about the company?
Yeah, very excited about Cryosa. Again, founded by Don Gonzalez. He came up with the patents back, many years ago, 2012, 2014. Brilliant concept. It took him a while to pull together. He pulled together Series A funding from a great venture firm called Sante Ventures, and part of that funding brought me in to run it as CEO back in 2018. We're really focused on the root cause of sleep apnea, which is the obesity, the fat, the adipose tissue that builds up in the airway, which then ends up closing off the airway. And as we all, get older, gain weight, there's really an obesity problem in the United States with people, weighing more than they really healthily should. That fat builds up and blocks the airway. So we're we're working on an innovative, minimally invasive technology that can remove that fat from the airway using a cryotherapy. So very excited to be part of it. Very blessed to be able to do that here in Minnesota.
Oh, right on. When you came in as CEO and company's Series A funded company, so still relatively early stage, what was it like kind of establishing that the first, maybe business isn't the right word, but establishing the organization? What went through your mind, and was it different from your experience, say, coming up and Inspire spinning out from Medtronic?
Yeah, really good question. I think one interesting part of that, Frank, during the interview process for this job, Don, the founder, was in Austin, Texas. The investors were in Austin, and part of the early discussions, hey, Mark, would you be willing to move to Austin, Texas for this, for the company? And I really love the idea. It's a brilliant solution to sleep apnea, and I was willing to consider that. But as I started thinking about it, I have no network in Austin, Texas, and all of the animal labs, the University of Minnesota, all of the tools that are kind of my go-to toolkit were here. So as part of that interview process, I went to them and said, hey, if we establish the company in Minneapolis, I'll have these key people, researchers, regulatory, clinical, all in their seats in the first 2 months, and we'll be doing animal studies right off the bat. So that that was a big moment for me to propose that, and they went for it, and we set up the company here. I think with the network here in town, it's so strong to be able to reach out to so many different people looking for those skill sets, whether it's contract or full time. It was very easy to find those people. A lot of the first people I brought in were really seasoned contract people who had been in the bigger companies. And then as time went on, I started pulling in people, for full-time positions. But yeah, it went relatively quickly and smoothly. And,
Right.
We founded the company in July of 2018, and we were, off and running by August. So.
Wow.
Yeah. I shouldn't say founded. We established it here. We moved, basically to shop. So, yep.
But yeah, you've mentioned now community and network a couple of times, and that seems like a very important part of your career and part of the work. I mean, what would be your advice to, say, budding entrepreneurs out there about like building network or building community if they're looking at starting or scaling a company?
Yeah, I think very important. Medtronic was a great foundation for me. A lot of the people that I got to know at Medtronic moved on to startups or moved on to other companies, and really keeping those networks alive. One thing I committed to myself when I left Medtronic for Inspire is, in Medtronic, you kind of run into people at the lunchroom in the hallways. You see people every day, but in the smaller companies, sometimes you have, when Tim and I were first starting, with two of us for a few months, and you don't see anybody. So really pushing myself to, take advantage of Medical Alley events, having lunches, just really being intentional about that networking in the community. And it's paid off. And I think people really like to network. This, for example, my research person who's here now, he and I would meet maybe twice a year for a number of years. And then things worked out to have him come in and lead the research team here. So.
Oh yeah, right on. And the comment you made about like when it was just you and Tim, I've heard that from a lot of entrepreneurs, that early on it can be very lonely if you're not intentional about building out the network and having peers, because you don't have the water cooler effect like you'd have at an established company. So yeah, well said.
Yeah.
Maybe related to that, and folks, I'll remind you, if you have any questions anytime, you don't have to wait till the Q&A section, just throw them in there. But if you went back to that time, like back to 2006, which, as I say that out loud, wow, that is actually kind of a long time ago now. What do you wish you knew then that you know now on your entrepreneurial journey?
Yeah, I think a couple things. One, I think, I would have focused less on fear of failure. That's always, as you take these jumps, you worry, okay, is this going to work out? And I think what I find is things definitely tend to if they don't work out, you'll find another path, but less fear of failure. Been fortunate on that path. And I think the other is really being more intentional about mentorship, finding people to help me as I grow in my career. It gets harder and harder as you move into higher roles and as you're smaller companies to find those mentors. And I think finding someone who really you meet with regularly and really get to know deeply, and someone who can really help interpret, okay, what's happening, how do I, grow myself, how do I, rise myself before the company need gets there, is something that I wish I would have been more intentional about over those years. Somehow I managed through it, but I think looking back, I could have benefited myself by being more intentional.
Oh, I agree with that one wholly. That I think the same thing, that I wish I had got mentors earlier in my career, because it would have sped up the development or maybe made some of the bumps smoother along the way.
Yeah.
Yeah, right
And
on.
my reporting, like Tim Herbert, a lot of the bosses along the way, were great mentors, but I think having someone outside your reporting structure is very beneficial. So
Yes, right on. Question from the audience, and they first say go Bethel Royals, so yay. They're
Right.
asking, when you're a Series A funded company, how do you determine, or how do you think about when to hire someone full-time versus to use a consultant or contractor?
Okay. Did my employees plant that one? No. Just kidding. That's a really good question. We
It is,
debate that.
we'll say anonymous.
We debate that all the time, Frank. I think I like to have a mixture, and it's really good to have full-time employees. They're passionate. They live and die by the company, and they work in the company for long-term and really get that knowledge built up inside the company. But I think there's also a really strong need for contract. It might be, for example, regulatory. We don't need a full-time, we can't afford a full-time regulatory VP, but a contract person there is fantastic. Sometimes maybe the mechanical engineer you need for the first 6 months is different than you need the 2 years later, maybe a starter versus a finisher. So sometimes in those roles, it's nice to bring in a contract. But it's getting harder and harder to find, talent in the community. But I think, a mixture of both is great. And when they have a contractor, and we really treat them, they're part of the team. I don't differentiate, hey, you're a contractor, you're an employee. It's really trying to make it a level playing field.
Yeah, well said there. I've seen some organizations where, when they have like company events, the distinction between employees or contractors comes up, and it doesn't seem like that's a really motivating way to engage people.
Yeah. I think there's people in my organization now that people don't, that they've been here a long time, and some people are surprised to find out their contract.
Very cool. Right. We've got another question from the audience, although it might be one I'll say you probably can't answer too specifically. We got a person just asking, how are the clinicals going for you guys?
Yeah, I don't want to go too many detail there, but we're excited to be in human clinicals, and it's going well. I'll leave it at that, but stay tuned. Yeah.
Very cool. Thank you. So as you've gone through a couple of startups over the years, one of the questions that I get a lot from entrepreneurs is on early stage med tech, starting a company, being able to raise money at those earlier stages is a challenge. And to be fair, it's a challenge to raise money, period. That is a tough job. I don't envy anyone who has to do it. But there are Series A and seed stage companies that do get funded. As you think about your career and you think about the industry, what do you think distinguishes between the companies that seem to get the traction and the ones that have struggled, setting aside, right, the product works, it gets market adoption, that part, like pre-commercial?
Yeah, I think really solving a really important unmet medical need. I think if it's a Me Too product, it gets harder. You have to really differentiate. But really, for example, obstructive sleep apnea, there's CPAP, there's other therapies, but they're really not hitting the market need for a cure. So hitting that unmet medical need with something that's really disruptive is important, and a big market. Unfortunately, it's sad for some of these medical therapies that have a small market, a $50 million market. Investors have a hard time getting excited about that. I wish there was a better solution to solve some of those smaller medical problems. That's number one, that market size. I think, having good intellectual property and freedom to operate would be my next question, and a lot of entrepreneurs that I talk to asking for advice really don't check that box as well as they should, really understanding how do they protect their idea once they get it to market. And then I think, having a really strong team that can execute, someone that has done it before, at least a couple of people that have done it before and have the right skill set is important. And I think, adding to that, I think having a good plan to get to, if you're going to raise money, how do you communicate I'm going to take your $1 million and get to a value inflection point that now we can raise Series B. Having a good plan around that is important, not just trying to advance the ball, but really saying, okay, this will get us to this point with reasonable certainty.
Yeah, right on. You can advance, but are you advancing to something that matters?
Exactly. There's concrete, some kind of risk reduction, whether it's proving it works in an animal model, proving it works in the human body, first clinical experience, something just to really take the risk out of the design.
Very good. Oh, and the questions now are just pouring in. Thank you, folks. We got one that it starts with no Tommies, although the person says they're married to someone from Bethel, so a little bit of balance.
Okay.
They're asking, how's the pandemic been for you guys, and how have you managed through that? How's it impacted Cryosa?
Yeah, great question. It's been interesting. Going back in May, we were about to go into human trials, back when the COVID hit. And, not to go into too much detail of the clinicals, but we're outside the US. And, I have to give credit to my team. We did some of our early traveling unvaccinated outside the US and had to really work through a lot of travel restrictions, travel shutdown, but we traveled extensively throughout the last year. And luckily, nobody was stranded or sick or ill through that process. We were careful, but that was difficult. And we had to really, I think the team had to take a lot of personal risk to be able to do those trips. In the office, we took the first month or two off, but the team here really likes to collaborate, be together. Zoom is great. The world has changed with Zoom, but the team really found energy being in the same conference room, even if we had to wear masks, but to be able to take a whiteboard and start writing things down and talking. And we did a lot of Zoom meetings, even in the office with all of us at our own desks. But, since about June on, we worked from the office carefully, very carefully. If people were exposed, obviously they'd stay home and quarantine. But I think that really helped us, not miss a beat through the COVID experience. But hopefully we're coming through that now, and hopefully we're all still in the office, but much more able to collaborate loosely. So.
Oh, very nice. And I'm with you. The Zoom and the hybrid, it's added a lot of great things, but we are humans. We are social animals. It is hard to beat being around people you enjoy working with and getting to be creative. And that Zoom just can't quite do that.
Yeah. And a great team here. We've been lucky and fortunate to not have any, a lot of us have had COVID over the experience, but no one's had, been severely ill, which is great.
Oh, good. Question out there asking, broadly defined, what percentage of your time would you say you spend on fundraising versus the day-to-day running of the business?
Yeah, I think the fundraising goes in cycles, and luckily it has not been a lot of time. I've been fortunate. I think the market is really good right now. We have really great investors and a really great, compelling story of what, OSA is a huge unmet need, and we have a perfect solution for it. Fundraising has not taken a lot. There's, maybe a 3-month season where we're out fundraising and closing that round. But I think, day to day, it has not been as big a burden as it's maybe been in past companies when cash was not flowing quite as freely. So I hope that continues. The last couple of years have been great. So.
I'm with you there. Yeah, the last couple of years have been strong for the market in general, strong here with $3 billion raised in 21 for Minnesota companies. Let's keep that party going for at least a little bit longer.
Exactly. Yep.
Yeah. I also know, if I'm recalling right, you're on the board of a very interesting company called Bone Foam. And something I wanted to ask about was not so much about Bone Foam, but about being a board member. So you're an executive, you're running a company, you have a board of directors, but then you're also on the director side. What's it like being a director, and how different is it from, being in the chair you're in today?
Yeah, it's been a great experience. Very, very exciting company, different product line, the commercial stage. So for me, being able to see a commercial stage company that has revenue helps me think about, how are things going to be changing at Cryosa as those days come ahead. I think for me, it's giving back. also, like this company did not have strong medical device experience. So it's really helpful. It's enjoyable to be able to come in and make an impact and help them make connections. I think we connected them to Medical Alley and just a lot of other connections in the community. And I think it helps me. It's really easy to get mired down in the day-to-day as CEO and really to see how a board sees a company kind of at 30,000 feet. Really helps me to get perspective. I'm still growing in that every day, how to be a better CEO, how to be a better board member. But I think those, just seeing another company going through their struggles and successes helps me, in my day-to-day here. So yeah, good question. And I think, feel fortunate to be part of that team. The Bone Foam is a great team of people, really good culture, really good product. So it's just fun to be part of their adventure too. So
very cool. You mentioned seeing some of the challenges like at the 30,000 foot level. When you've talked with other entrepreneurs or others in the community, what are some of those like top level challenges that you're seeing? You mentioned talent, and we know that's been a big one lately as the economy's been oddly strong in some ways. What other things do you see out on the horizon as a challenge to the industry?
Yeah, I think I have a few different entrepreneurs that I know, trying to raise that first Series A or first seed funding. That still is a challenge. There's not many investors willing to do that de-risking, that first fund raise. And I think that, I think we're seeing more family offices and people who want to give back with their money, and those people are funding some of these projects. There's some great people in town here that are stepping up and doing that, but that's still really tough to raise. I mean, there's a lot of funds that will fund Series B or C or beyond. But at that point, the risk, there's still plenty of risk, but it's a going concern at that point. So I think that's one of the challenges. And I think, Medical Alley could help there. There's other investors that could help. And, Dr. Glenn Nelson was very strong in that space. He's passed away, but that was really an area that he came in and helped mentor those early startups, getting them to a point where a larger VC would fund them.
Yeah, that is well said. I don't think enough people appreciate the impact that Dr. Nelson's had across the industry, that companies today that are now successful, and not just in device, but I think many don't know he was also an investor in digital health companies, and that has now become one of the fastest growing parts of the healthcare community. So yeah, one person making an effort can really make an impact, but we need more of that.
Absolutely. And I think they're coming. I see some signs of that, but that's, that would be my hope, to see other people who have been successful, come back and help fund some of those new startups.
Mm-hmm. As we're getting close to wrapping up here, and folks keep sending in the questions as you have them. One of the things I always like to ask is just, you've gone through this last couple of years. It's been a challenging time. What are you most looking forward to, whether it's for the company, for yourself, as we hopefully start to come out of maybe pandemic to endemic? What's on your horizon?
Yeah, I think, looking at the company here, we're very excited. To me, it's like a really good football season, watching the beginning to the end and going for the Super Bowl, so to speak, right? We're as we move through the phases of the company, it's just every day you wake up with a mission to advance the company to the next level. And that's really exciting. Having a team of people who are all rowing the boat the same direction is really fun. So, probably busier than I want to be, not spending as much time, golfing or those type of things. So maybe someday, 5 years out, I might take a year to do that. But near term, it's just really fun to be part of a mission that everyone believes in. So that's, my focus. And we have milestones that we can't wait to see those milestones come in and see how things result. And that's, makes for a very exciting summer ahead.
Right on. Well, I think that's a good place to wrap it up. We had, folks, a fantastic set of questions from the audience, so I really appreciate it. Mark, this is a great discussion. I appreciate you taking the time out of your busy day to spend it with us. And I'm so thankful that we have incredible entrepreneurs and innovators like you right here in this community. So please, anytime, to you and to everyone in the audience, if we can be of service, do not hesitate to reach out.
Yeah. Thanks, Frank. Thanks for the opportunity, and thanks for all that you and the whole staff at Medical Alley do. Appreciate it.
Oh, yeah, it is our pleasure. And folks, that is the Medical Alley Show. I hope you have a great rest of your day.